Hello. You may ask yourself, why do we vaccinate our children? Where are these diseases that are so feared? Should I have my child immunized? These shots are painful, take time and effort, and sometimes even cause fever. These diseases are now so much less common than in the past. My children are grown now, but when they were young, I sometimes wondered about the value of vaccines that were available and if they were really necessary. So I think we should step back in time and examine the change in the lives of children due to vaccines. I am a pediatrician, the kind of doctor who takes care of children.
And I am an internist, a doctor who takes care of adults. Because the diseases that vaccines prevent aren't very common, sometimes it's hard to imagine what they are, whether they are serious or not, and whether your children should receive the vaccines that prevent them. We often hear questions about vaccines, but we'd like to focus on the diseases that vaccines prevent.
Before vaccines were available, nearly everyone had a series of infections as they grew up. Different germs were more likely to infect you at some ages than at others. Starting even before birth, certain germs could make you ill. We will talk about the various bacteria and viruses that can cause serious infections in your children. Perhaps this discussion will help you make an informed decision about the need for vaccines.
First, we might ask, what are germs anyway? Well, there are two kinds that we'll talk about, bacteria and viruses. We'll give you some examples of each.
Bacteria are really tiny little organisms that can only be seen in a microscope. But even though they're very tiny, certain kinds of bacteria can make people very sick. How do they make people sick? By growing in a place in the body where they shouldn't be, like your brain or your blood. Sometimes bacteria can make a chemical called a toxin that can make you sick by spreading to distant parts of your body. Some types of bacteria that make you sick are Bordetella pertussis, Corynebacterium diphtheriae, Clostridium tetani, Neisseria meningitidis, and Haemophilus influenza type B. Sometimes you can tell a little about the disease each bacteria causes by its name.
Viruses are much tinier than bacteria. They can only be seen with a powerful electron microscope. Viruses make you sick by destroying certain cells in your body, interfering with the functioning of the organ in which the cells are living.
Some examples of viruses that can make you sick include influenza virus, which invades cells in the respiratory tract, rabies and polio viruses, which invade cells in the nervous system, hepatitis virus, which invades cells in the liver, and mumps virus, which invades cells in your salivary glands. Each kind of virus has a preference for certain kinds of cells in your body.
Now we'd like to give you some examples of the kinds of infections you might have that could be prevented by vaccines, starting with your days you spend in your mother's womb and into birth, childhood, adulthood, and old age. We hope you find the descriptions of these infections informative.
If your mother was infected by rubella virus when she was pregnant, the rubella virus might also have infected you and damaged cells in many tissues that were just forming. You might have been born with multiple defects of the eye, heart, and brain, as seen here. In 1973, as a medical student, I was assigned to a congenital rubella clinic at Texas Children's Hospital, where many children and their anxious families, often without insurance, sought care for complex problems. And about 50 years ago, my cousin was hired to care for a child with congenital rubella syndrome. Even though the child was severely disabled, her family had decided to keep her at home and care for her rather than institutionalize her. Now, many decades later, family members are still caring for that child. It's hard to imagine how much effort was required from this family. Hepatitis B. If your mother was a carrier of hepatitis B virus, the virus might infect your liver at the time of your birth and decades later causing scarring, called cirrhosis, and possibly liver cancer. This picture shows a liver in those three stages of hepatitis B infection. In the early 1980s, I was part of a refugee clinic at Georgetown University where we saw Indo-Chinese refugees with various infections. About 25% of them had chronic infections with hepatitis B virus. Adopting families needed to be instructed on necessary precautions to prevent further infections. Neonatal tetanus occurs mainly in very poor places where mothers have not received tetanus immunization and have no antibody against tetanus to transfer to their babies. These infants may be born in homes with dirt floors. Umbilical cords are to be cut with a knife contaminated with Clostridium tetani, the organism that causes tetanus, which normally lives in the soil. The bacteria secrete a toxin which travels to the baby's nerves and causes severe muscular rigidity and stiffness, as seen in this picture. Death is common in babies with neonatal tetanus. Rotaviruses cause 40% of hospitalized cases of infant diarrhea. Most of these cases occur in the first 3 years of life. There's a sudden onset of watery diarrhea, fever, and vomiting. Fever and vomiting may persist for 2 to 3 days and diarrhea for 4 to 5 days. Many children become seriously dehydrated with skin that wrinkles easily, as in this picture.
As a person moves from infancy to childhood, other bacteria and viruses will be a danger. Corynebacterium diphtheriae, the bacteria that causes diphtheria, might have given you a sore throat and secreted a toxin that could cause heart or nerve damage. My mother related a story of a child with diphtheria.
My name is Elizabeth Hoke. I'm 91 years old, but when I was 10 years old, I sang in a choir at our church. One Sunday, as we were putting on our choir robes, I noticed a robe still hanging on the rack. I asked, "Whose robe is this?" Someone answered, "It belongs to Margaret Smithers." "Where is she?" I asked. "She died of diphtheria," someone answered. I've never forgotten that story. And when diphtheria vaccine became available, I made sure my own children were immunized.
And we also have a story from Irina, who grew up in the Philippines.
Yeah, I remember that I was ill with diphtheria. My parents were worried that I might die. The doctor put me in the hospital. Unfortunately, I recovered.
Whooping cough is caused by Bordetella pertussis, a bacterium that spreads from one person to another through the air. It causes a throat infection with a characteristic whooping cough, accounting for the common name of this infection. Adults may be infected for long periods of time, during which they can transmit the infection to their children. In 1976, 2 young parents brought their 4-month-old baby boy to the University of Colorado Hospital emergency room. The child had a fever. The parents were worried about his continuous spasms of coughing, which were regularly followed by vomiting. He had been sick for several days and was very dehydrated. His tiny body shook with each coughing spell, and retractions of the muscles between the ribs with each breath indicated his respiratory distress. His chest x-ray showed he had pneumonia, probably from having inhaled vomited material as he tried to catch his breath. He was unable to eat food or drink liquids. The doctors placed him under a plastic hood with oxygen and water vapor mist. They gave him fluids and nutrition through an intravenous tube. Although his parents were anxious to leave, the child continued to have long bouts of severe coughing, followed by vomiting, for 4 to 6 weeks, before he was finally ready to leave the hospital.
And we recently interviewed a woman who had been a part of a pertussis outbreak at her high school in San Francisco.
When I was a junior in high school in 2014, I was on a camping trip when I began to feel sick. During the week after we returned, I developed a dry, hacking cough. Sometimes I would cough many times before I could stop. On a college road trip with my parents, my cough became persistent, and I was unable to control it during presentations. Because of the nature of my cough and because several other students had similar coughs, pertussis was suspected, and nasal cultures were obtained. I was treated with antibiotics, and over the next 3 weeks my cough resolved. A culture confirmed that I had pertussis. At least 15 of 400 students in my high school were diagnosed with pertussis.
Measles virus is extremely infectious. Before vaccines, measles virus would surely infect you and others causing a fever, rash, red eyes, swollen lymph nodes, and sometimes pneumonia. Children with measles are really miserable.
Measles virus has a special talent for seeking out the unimmunized. As an epidemic intelligence service officer at the Centers for Disease Control, I investigated an outbreak of measles in a high school in remote Hettinger, North Dakota. Doctors who had arrived 10 years before the outbreak had faithfully immunized all newborns, but children already in the community grew up in a group susceptible to measles. Following an away basketball game, measles virus was brought back to the locker room and transmitted in several waves, eventually involving much of the high school. This outbreak shows the incredible ability of measles virus to seek out and infect the unimmunized. Mumps virus would give you a swollen face with pain when you swallowed.
My sister had a remarkable mumps case when she was a teenager. Her face was swollen and the first day of school was fast approaching. We thought she looked funny, but she was very upset by her appearance, so mumps virus had a disruptive effect on the beginning of her senior year in high school. In males, mumps can cause sterility if they become infected in adolescence or later. Influenza virus might be transmitted to a child in school, causing chills, a sudden fever, a runny nose, a cough, and sometimes pneumonia or other complications.
We learned of a family that had recently lost a child due to what were thought to be the effects of influenza virus on her heart. Her parents started a website at which families could post stories of influenza losses at www.familiesfightingflu.org. Look for the story of Jessica Stein. This graph from CDC shows the reported weekly number of pediatric deaths due to influenza in the United States. About 150 children die each year of influenza. The number could be much higher in certain years.
Millions of children were affected by polio in the 20th century. If a child was in contact with someone who was infected by poliovirus, or if they swam in a pool where children who were shedding poliovirus were swimming, poliovirus might infect her too. The virus infects and damages the nerves that control the muscles of her legs, arms, chest, and causes paralysis of these muscles.
We've heard stories of children becoming paralyzed while riding home on the school bus. It wasn't hard to find a person who had been affected by polio. We interviewed a friend of my mother's who had had polio. On a summer day in 1950, she became weak after happily riding her new bicycle. Her doctors sent her by Army Air Ambulance to Denver Children's Hospital, where polio was diagnosed. Her breathing muscles were paralyzed, so she lived in an iron lung, like those in this picture, for 3 months before she could breathe on her own. But her ability to walk never returned, and she has required a motorized scooter chair for the rest of her life. Based on her experience, and despite her paralysis, she obtained an advanced degree in counseling and wrote a book entitled Just One of the Kids that advises families how to care for a handicapped family member.
Sometimes people who've recovered from polio develop post-polio weakness in other muscles 20 to 40 years after they've recovered from their initial episode of polio. Chickenpox is caused by the herpes zoster virus and is easily transmitted among children, causing a rash that is small blisters, very itchy, covering the body in waves at different ages of pox. In the late 1980s, we had several of our own children home with chickenpox. Chickenpox in one child was followed by infection in another, so cases spread over several weeks. Sometimes the breaks in the skin become infected by a bacteria that causes impetigo.
Smallpox, an eradicated disease. And if the variola came to your town, it might infect you, giving you a fever and causing blister-like pox to appear simultaneously all over your face and body. After enormous effort by public health doctors and nurses, transmission of smallpox virus was completely interrupted in 1979. There are no more cases of smallpox anywhere in the world, so smallpox vaccine is no longer needed to protect children. But the virus still exists in certain laboratories, and bad people might release it once again. Recently, the United States military prepared to fight in a country which was thought to have smallpox virus, so the war was delayed until all American soldiers could be immunized with a licensed smallpox vaccine.
Infections with the Haemophilus influenza type B bacterium can cause a sore throat, croup, and an inflammation of the epiglottis, which can be life-threatening and very sudden. Meningitis was also common. I saw several such patients in my pediatric practice, and lifelong disabilities can often result. The pie chart shows the types of complications this bacteria can cause.
In 1980, a U.S. Army family was stationed in rural Korea. They had a 9-month-old child who developed an ear infection and meningitis due to infection by Haemophilus influenza type B. The child survived but was severely disabled. 36 years later, the family is still caring for this person, now an adult in size. Nowadays, children are immunized against this bacteria, and the number of cases of severe infection have fallen, as seen in the pink graph.
Pneumococcal infection. Streptococcus pneumonia bacteria causes many types of infections. Pneumonia, arthritis, and meningitis are among the most serious. The bacteria has many types. Individuals who have lost their spleens or who suffer from sickle cell disease are especially susceptible to life-threatening complications of pneumococcal infection.
If a rabid animal bit you, its saliva would carry the rabies virus into your tissues. The virus would enter your peripheral nerves and make its way to your brain, causing a fever and encephalitis, and almost surely killing you. I was in the public health service in the early 1970s, and we received many questions about animal exposures and rabies.
In the U.S., bats and raccoons are a special concern. Abroad, dogs may transmit rabies virus, so travelers should take care.
If you were traveling in Asia or Africa and had an automobile accident and needed a blood transfusion, or if, as a doctor, you pricked your finger on a needle that had been used to draw blood from a person with hepatitis B, you might develop acute hepatitis B yourself. I've been involved with several such cases.
Human papillomavirus. You might become infected by human papillomavirus as a result of early sexual activity. If you are a young woman, cervical infection might result in the presence of abnormal cells and warts. The viral genome might become incorporated into the DNA of your own cells, setting the stage for later complications. Young men can be infected too. If you join the military, you would be housed in barracks with other young soldiers who might be susceptible to respiratory infections. Deployments around the world would provide additional risks. Military doctors worked hard to determine which organisms were making soldiers sick so that vaccines could be developed to minimize the impact of these infections.
Influenza virus could spread rapidly, killing many that battle spared, as happened in 1918. Concern that such epidemics might affect military training and readiness led to development of influenza vaccine and universal immunization of soldiers beginning in about 1942, decades before such immunization of the general public. Neisseria meningitidis might colonize your throat and cause meningitis or meningococcemia. During military mobilizations, cases of meningococcemia, such as in this man, and meningitis led Army scientists to invent vaccines to prevent most types of meningococcal infection.
College students are also at risk, and many colleges now require immunization against meningococcal infection.
Adenoviruses, especially type 4, would cause fevers, sore throats, coughs, and runny noses, and make trainees miss training. The blue area indicates that there are far more adenovirus type 4 isolates than the number of isolates of any other organisms that made trainees ill.
Hepatitis A. If your drinking water or food was contaminated with sewage, or someone with hepatitis A lived upstream from you, hepatitis A virus could infect you and damage your liver, causing you to have nausea, vomiting, yellow skin, and eyes.
Because of poor conditions in wars, hepatitis A was a special risk to soldiers in wartime, leading to invention of the hepatitis A vaccine by Army scientists. If you were wounded in battle or cut yourself, Clostridium tetani toxin would make all of your muscles contract in the convulsive spasms of tetanus. As in this picture, you would arch backwards with a force great enough to cause compression fractures of your spine. In 1973, at Methodist Hospital in Houston, I cared for a 50-year-old woman who had neither been immunized against tetanus as a child, nor had she been in the military, where she would certainly have been immunized. Later, she cut herself on hedge clippers and developed tetanus or lockjaw. Following a month in the ICU under sedation and intubated, she recovered.
Japanese encephalitis. If you lived in Asia near a rice field, in a house where your family raised pigs, a mosquito might bite you and transmit Japanese encephalitis virus from the pigs to you. You might have a fever, seizures, coma, and brain damage so severe that you would be unable to learn or be paralyzed in one or more limbs.
The Army assigned me to work in Thailand for several years. I saw wards full of such children, and even European visitors with Japanese encephalitis. Concern over the risk to U.S. forces at the end of World War II led to development of formalin inactivated JE vaccine at Rare by Albert Sabin. And some of the infections you acquired early on might return to haunt you later.
Remember the day of your birth when hepatitis B infected your liver? Many years later, you might develop cirrhosis, liver failure, and finally liver cancer. Remember the chickenpox. The herpes zoster virus remained dormant in your nerves. Reactivated, it could cause severe pain, followed by a crop of very painful blisters in the rash of shingles, as it has happened in one of my very own children. And what about the papillomavirus that infected Henrietta Lacks' uterine cervix when she was a young woman? Transformed cervical cells would become a fatal cancer. It would be a dubious honor that her HeLa cells would be immortalized with her initials. But if you were lucky enough to have been born after vaccines were invented, you would not have had the infections caused by rubella, hepatitis B, rotavirus, diphtheria, pertussis, tetanus, mumps, measles, polio, herpes zoster, H. flu B, or influenza.
Or smallpox, streptococcus pneumonia, rabies, Japanese encephalitis, Neisseria meningitidis, adenovirus type 4, tetanus, hepatitis A, or human papillomavirus.
We've discussed many bacteria and viruses that can cause diseases and that can be prevented by vaccines. Vaccines have been so successful that it's easy to forget how much they help us. Until vaccine-preventable diseases have been eradicated, our children will be at risk of exposure and infection for the rest of their lives whenever they might travel.